So the most common reason why people come in to see me to get stem cells injected is musculoskeletal issues, strains and sprains and joint issues, and the most common probably being wear and tear or degenerative arthritis in the knees and hips. Although we can do any joint and any tendon in the body, those are the most common, knees and hips, where we have great response. They're easy to inject. Instead of putting a medication into those areas, we take an isolate of stem cells and we inject it directly into the joint for a healing response. We're looking for response over 3 to 6 weeks, and maybe not complete resolution, but advanced degenerative issues may take a series of injections to do. So one of the ways that we get around with a series of injections is on your initial stem cell. When we harvest the stem cells, either from the blood through the bone marrow or through the fat, we take an extra sample and we send it to a cryo lab that holds it and stores it, and it's called banking of stem cells. They can then take your stem cells, and every 90 to 120 days they can generate another set of your stem cells that they grew off this Petri dish, and then those cells can be used just for injection without the procedure to remove the stem cells. So I think for people that have chronic degenerative issues, to bank their stem cells and do a series of maybe 2 or 3 for advanced cases is a great idea. In some cases, especially with knees and hips, we do one shot and people are like, wow, that was great, and we may not see them again for a long period of time for those joints. And that's what we always hope for. We can use stem cells for fingers and elbows and inject trigger fingers. We can inject tennis elbow. We can inject frozen shoulders. And the benefits of the musculoskeletal system are well documented with orthopedics, and a lot of orthopedic surgeons are beginning to use more and more stem cells instead of suppressing the body's system with a corticosteroid, which is an anti-inflammatory. We're stimulating the body's healing system with regenerative medicine and stem cells. The most common person, again, that presents to me is a musculoskeletal injury, a chronic issue, wear and tear, maybe a runner or an athlete that's had a joint that's had repetitive stress. Any patient can benefit from stem cells to facilitate the healing rate. As we age, our healing rate goes down. When you're 5 years old and you fall and you hit your knee, you cry, you wipe it off after a couple minutes, and then you're back to functioning. When you're 15 years old or 25 years old, you fall and you hurt your knee. Maybe you don't cry, but you get up, you wipe it off, and it's better in a day or two. But when you're 35 or 45 years old and you fall and you hurt your knee, you may fall and curse instead of cry, and then you get up and you wipe it off, but usually it's a few weeks to a month before it gets better. And then when you're 65 or 75, that same knee injury, which used to heal in a day or a week or a month, just doesn't heal anymore. Or you keep aggravating it before it heals. So this is the classic person that is not healing, that wants to get regenerative medicine. Regenerative medicine takes the healing rate of an 80-year-old or a 70-year-old and turns that into a 50 or 40-year-old. Takes a 40-year-old's healing rate and turns it into a 20-year-old. So what we're doing is we're accelerating the rate of healing by injecting the healing cells, which are stem cells, into the area of injury. Stem cells live in your body and are used to heal and replace the normal cells all the time. If we did not have stem cells, we would die within 3 days. So our body's always rebuilding the new lining of skin, a new lining of a stomach lining. Even nerves and organs are eventually, they say every 7 years, they're totally new cells. That's because stem cells have replaced them, and if there was any injury, they healed them. So the idea of giving the stem cells is to stimulate the body's natural healing response in an accelerated rate. There's nothing the stem cells do miraculously except what they do on a daily basis, which is miraculous healing. So we're just increasing the concentration of those miraculous healing cells in an injury, and it's a very effective treatment. Patients are concerned about the injection of stem cells or anything into their joint, whether it be a corticosteroid or Synvisc or any kind of regenerative medicine technique. The needle hurts a little bit, and sometimes there's some pressure, but it's very well tolerated, and anyone that's had any type of joint injection before, it's a similar injection. So we're just not putting medicine in, we're putting in your own cells that create a regenerative response. So the technique for any of the joint injections is very similar to how an orthopedic surgeon or a sports medicine doctor would do an injection with a corticosteroid, and they're very well tolerated. So the healing response in musculoskeletal injuries treated with stem cells is 3 to 6 weeks. We look for most people to see a benefit over that time. The more chronic the injury's been there, the longer it takes to heal. The more acute injuries will heal faster. So it really is a factor of how old you are and how long the injury's been there.